Is Senator Dan Sullivan's political career already on the brink of collapse? When health insurance premiums skyrocket and access to care becomes a luxury, voters have a right to be furious. Before we continue, if you want to stay on top of everything happening in US politics, hit that subscribe button right now and leave a like. It really helps this channel grow. Now, let's dive into what's happening in Alaska, because the situation there is a stark warning for any politician who takes their constituents' well-being for granted. We're seeing a critical issue emerge that could very well decide the fate of Republican Senator Dan Sullivan's re-election bid. The core of the problem lies in recent healthcare cuts, specifically linked to the controversial One Big Beautiful Bill Act and the lapse of Obamacare subsidies. These aren't abstract policy debates happening in a faraway capital. These are decisions that are hitting Alaskans directly in their wallets and in their health. For many in the last frontier, the cost of healthcare has become an unbearable burden. The One Big Beautiful Bill Act, a piece of legislation that, like many in Washington, promised progress but delivered pain for many, has reportedly led to significant healthcare cuts. What those cuts specifically entail is a complex web of reduced benefits, increased out-of-pocket expenses, and for some, a complete loss of essential services. Adding to this already dire situation is the lapse of Obamacare subsidies. These subsidies were designed to make health insurance more affordable for millions of Americans, including many in Alaska. Their expiration means that many individuals and families are now facing substantially higher premiums, making it incredibly difficult, if not impossible, to maintain adequate health coverage. This is precisely the kind of vulnerability that political opponents look to exploit, and Democrats in Alaska are not letting this opportunity pass them by. A Democratic ad campaign, launched just late last month, has zeroed in on Senator Sullivan, directly accusing him of voting to raise health insurance premiums for Alaskans. The ad, which is now circulating and likely to be amplified as the election cycle heats up, aims to paint Sullivan as out of touch with the needs of his constituents, someone who prioritizes partisan agendas over the health and financial security of the people he represents. The narrative being pushed is simple and, for many voters, incredibly resonant: your healthcare is more expensive because of this senator's actions. The implications of this are profound. For Senator Sullivan, these healthcare cuts and the resulting premium increases represent a significant vulnerability. His voting record on healthcare legislation is now under intense scrutiny, and he faces the difficult task of defending his decisions to a growing number of concerned Alaskans. The Democrats, on the other hand, have a clear and potent message to rally voters: they are fighting for affordable healthcare, and Sullivan is standing in the way. This issue has the potential to mobilize voters who might otherwise be disengaged, particularly those who have directly experienced the sting of rising healthcare costs. Who is most affected by these changes? It's likely to be middle-income families, young adults, and individuals with pre-existing conditions who relied on the ACA subsidies to make coverage manageable. These are often the very people who are most sensitive to even small increases in premiums and deductibles. For rural communities in Alaska, where healthcare access is already a challenge, the added financial burden could mean making impossible choices between medical care and other essential expenses. This isn't just about numbers on a balance sheet, it's about people's lives and their ability to receive timely and affordable medical treatment. The possible outcomes are multifaceted. If the Democrats can successfully capitalize on this issue, it could energize their base, attract independent voters disillusioned with rising costs, and ultimately contribute to Sullivan's defeat. For Sullivan, the path forward involves either attempting to shift blame, highlighting other aspects of his legislative record, or, perhaps most effectively, advocating for policies that would counteract these premium hikes and healthcare cutbacks. He needs to demonstrate that he understands the severity of the situation and is actively working to find solutions. A failure to do so could be politically fatal. This story is a potent reminder that in politics, especially in the United States, healthcare remains a deeply personal and often decisive issue for voters. The economic and personal consequences of these legislative decisions are now a central theme in one of the most closely watched Senate races. So what do you think about this? Is Senator Dan Sullivan responsible for the healthcare cuts impacting Alaskans, or are there other factors at play? Drop your opinion in the comments below. I read every single one. The political landscape in Alaska is clearly shifting, and the battle over healthcare access has just become the defining issue. We'll be watching this story closely.